Hello there, you're watching Epicentre on CNN News 18. I'm Maha Siddiqui, starting the show with some breaking news that is coming in. JP Nadda, the BJP chief, is in Hyderabad to protest against the arrest of Telangana BJP chief. Those are details that are coming in. The Bharatiya Janata Party national president is in Hyderabad to attend a candlelight rally to protest against the arrest of BJP Telangana state president Bandi Sanjay Kumar. Why has this arrest taken place and what about the protest? Because I understand that there was some hit as far as the protest was also concerned. The state government not very comfortable with that as well. Swastika is joining us with more details on this. Swastika, was this protest allowed?
Yes, Maha, this protest was allowed, and this is why BJP President JP Nadda has arrived at the location, and as we speak, he is holding a token protest here. But the BJP has decided to cut short the candle march rally because of the COVID restrictions that have been put in place in the state of Telangana as Omicron cases spiral out of control. Now, the TRS and the BJP are locked in a brutal war of words in a way after the TRS government arrested BJP Telangana President Bandi Sanjay while he was holding a dharna in his constituency day before yesterday in Karimnagar for violating COVID protocol. Now, since then, his bail was rejected by the Karimnagar Sessions Court, and he has now been sentenced to judicial custody for 14 days. Mr. Nadda's arrival here in Hyderabad as a mark of support to Bandi Sanjay is symbolically significant because the BJP is trying very hard to expand its footprints in the state of Telangana. Okay. And the national leadership is very keen on helping the state leadership to ramp up its image. That is why this protest led by Mr. JP Nadda is very significant. And that's not all. In the next 14 days, the BJP leadership will be bringing in national leadership from the top to lead the protest for the next 14 days. That is how they want to continue with the narrative that they are here to expose a corrupt government like the TRS.
Swastika, many thanks for joining us with those details. On to our discussion now. The Omicron variant is here, and be under no misconception that it will be like a mild flu. Though most vaccinated persons are indeed reporting mild symptoms, experts are warning not to take it lightly. This is for two reasons. First, not everyone is reporting only mild symptoms. And secondly, because even if a lot of people fall ill together with mild symptoms, but a percentage of that needs specialized care, that is hospitalization, that could stretch the healthcare system, which definitely would be worrying. No one, absolutely no one, wants to see a repeat of the second wave that we witnessed last year. So beware and think again. Is mild symptoms theory based on evidence or science, or is it just misplaced optimism? Discussing that this evening on Epicentre. So don't panic, but don't take the threat of Omicron lightly, and here's why. First of all, Omicron, this variant of COVID-19, is highly transmissible and less susceptible to vaccines. That means that it can break the immune barrier. It has immune escape, and that is why one should be wary under these circumstances. Moreover, it can evade antibodies that have been produced either by vaccines or, in fact, even by those who have been naturally infected. Cases are doubling every 2 to 4 days, which is much faster than what we saw as the Delta variant ravaged through India. This was identified on the 26th of November by the World Health Organization as a variant of concern, but without a booster at the moment in India, since that will only go on the floor from the 10th. Without booster, 2 vaccine doses give less protection. At least That has what has been the experience of some of the countries. Meanwhile, what are we seeing abroad? Hospitalizations are overwhelming by unvaccinated patients, largely those who are coming to the hospitals. So a double dose of a vaccine gives you some amount of protection, but there is immune escape, so you need to be careful. A booster dose gives you better protection, but even in those cases, we have seen people contracting Omicron variant. Let me now go across to our guests who are joining us on the show. Dr. Sanjeet Sasidharan, Head of Critical Care Fortis SL Raheja Hospital, Mahim. Dr. Arvind Soin, Chairman of the Liver Transplant and Regenerative Medicine Medanta and RF Hospital. Dr. Jaleel Parkar, Pulmonologist, Lilavati Hospital. Dr. Anupam Sibbal, Group Medical Director, Apollo Hospitals. Dr. Swain, I want to come first to you. Is the theory that Omicron was mild, was what made people complacent? Is that why we are seeing a sharp rise in numbers all of a sudden, even here in India?
Well, I think there is no doubt that Omicron seems to be milder than its earlier version, the Delta variant. So there is no doubt about that. And I don't think it's complacency because of the realization that it is mild, but also the fact that we've not had significant infection in the population for the last 6 or 7 months, that people were trying to get back to normal life. And when they heard that, people who are vaccinated do not get severe disease and Omicron is not mild, yes, that has played a role in them not actually taking enough precautions. But now is the time to lock ourselves up, absolutely avoid crowding, vaccinate people who've not taken their second shots or boosters or who are eligible for boosters. They should all vaccinate. And we do have to mask up and wear 2 masks or at least 1 N95 mask. So this is the time to take all kinds of precautions because Omicron is well and truly here. And even if the cases are mild, the sheer numbers are going to overwhelm us. So even if the rate of hospitalization is 20 or 30% compared to the Delta wave, but if we have 5 times the number, we're going to be in the same mess we were in April, May last year.
That's a word of caution. People should remember that. Dr. Jaleel, what are the typical symptoms where one should look at seeking help? That means hospitalization and not just be dependent on home isolation.
See, most of the patients who have been complaining, and I think they have been complaining for the past 4 months, was a severe sore throat, headache, a little bit of body ache and fever for a day or 2. Now, the patients who develop fever and are not responding even after taking symptomatic medications for 4 to 5 days, they are the patients who should approach the hospital. Number 2 is if the cough is increasing, where they are coughing 15 times, 20 times in a day while they are awake, I think they should go to the hospital. The third is that they have a lot of comorbidities and their age and the fever doesn't respond. I think they should go to the hospital. And last but not the least is the saturation. If it falls down, if they have observed and they start feeling breathless, I don't think they should waste time at home. Rather, they should approach the closest institution possible so that they can be treated. Now, my reckoning is that hospitalizations should be reduced as much as possible because otherwise everything just collapses and crashes down. What we should do is we should try to see whether the patients are treated, whether you treat them with medications at home, the newer ones that have come, or you give them the monoclonal antibody cocktail, which is doing the wonders, where patients come, they spend 3 to 4 hours in the triage, they take their medications and they go back home. Pushing admissions will unnecessarily take its toll on the health system. You must remember that most of the medical RMOs, the staff, the nursing assistants, etc., and even the consultants in most of the major hospitals have now got COVID. So the staff constraint is always there.
Yes.
And that is where when the patients come to the hospital, they complain that they are not getting proper treatment. It's not that they are not getting, or we don't want to give them the right treatment, but the pressure is so much that it is taking its toll on all of us. So I feel that there should be a cooperation from the people who are ill. We understand that they are very anxious and they want to get into the hospital and they want the best of the treatment. But sometimes the
Unnecessary
overload is so
admission
much
is, yes.
that we are not able to.
All right. And Dr. Sibal, I want to take that thought forward, which was just made about the healthcare workers also getting impacted in Delhi alone. We are hearing news of healthcare staff from Safdarjung to AIMS and Hindurao Hospital, all testing, many of them testing positive. Isn't this worrying? If healthcare workers fall sick at this rate, who will take care of the patients? And the numbers are only going up right now.
Good evening. Pleasure to be on your show.
Good evening,
so
sir.
basically, when you have a variant like the one that we have, which is highly transmissible, it is going to spread the way it's spreading. So what we need to do is look at strategies on how we can prevent this kind of spread that we've seen in Europe, we've seen in Africa, and now we are seeing in India. So one, of course, is for the frontline workers, healthcare workers, those who are more vulnerable should get the third dose, which is happening from Monday. We really do need to be very cautious in terms of COVID avoidance behavior. Having masks that are not properly on or having masks other than N95 is something that I think we need to do away with. Social distancing and hand washing and sanitization is crucial. Of course, if healthcare workers get infected, then it is a problem because who's going to look after patients? But what we are seeing, despite the high degree of transmissibility, and I have to say that this is early days when it comes to Omicron, we don't really know how this is going to pan out over the next weeks to months. But definitely the hospitalization rates are much lower everywhere, which of course is positive. And let's hope that that is the trajectory we see in India as well. And the system does not get pushed. But the point here that I'm trying to make is that we need to look back at early 2020 and develop that mindset again. There is no such thing as a bubble. I'm a pediatrician, so parents keep saying, though, we meet other parents and kids in a bubble. There is no such thing as a bubble because you could be absolutely fine with no symptoms and then turn positive next day with virtually no symptoms, and you would have passed on the infection to someone else. Unlike the Delta, where the symptoms were pretty pronounced, here, because the symptoms in a significant proportion of individuals are very mild or they might be asymptomatic, this whole thing about being in a bubble is something that we need to do away with. You have to be very, very cautious. Everybody needs to be masked up. Everybody needs to avoid contact as much as possible unless it's absolutely essential. And therefore, having the kind of restrictions that we are having for social gatherings and so on are welcome. And I think everybody needs to be very careful in asking themselves this question: do I need to engage in this activity? Do I need to meet this person? Is travel essential or not? And because a lot of things can happen virtually, because if we do that, then we'll be able to contain it. So one has to be very judicious. One has to be very careful. There is no need to panic. But of course, one needs to be very, very careful.
Certainly, very important advice there by the doctor. Dr. Sanjeev, I want to come to you. Did India delay the decision on booster jabs? Partly, perhaps, and only you will be able to tell us, relying on the theory that Omicron may not be that severe. Was that a mistake on our end? Because boosters open up from the 10th. We are still about 5 to 6 days away.
So if you look at a scientific perspective, the booster should have been there way back almost 3 months ago, is what it appears on a scientific perspective. What's important to note is that these boosters are effective even against variants, and that's clearly been proven in a number of studies that have come forth, which says that the affinity binding or affinity maturation of these antibodies are even much more stronger, makes it much more stronger to fight these particular viruses. And we know that vaccine-related immunity very clearly wanes off as early as 3 months. I mean, 3 months is what many studies have said. So going at best, at least at 6 to 8 months, we should have had the booster is what I strongly believe. And that's probably the reason that healthcare workers who were the people to get the vaccines the very first time it was introduced. They are actually now in masses and numbers are actually going down. And that's training the system majorly. You must understand that it's not only COVID disease, we also have other diseases, and the other diseases like heart ailments and orthopedic fractures and all are suffering because of the fact that many of our doctors are falling ill. What is important to also note is that, that these severe cases that we are all talking about, whether this is going to become severe, these severe outcomes will take several weeks to accumulate. We know it from Delta also, and it is longer to be evident at population level, impacting all these rates. Therefore, at this moment, we don't know whether this is going to become severe. When it gets exponential, and it's going to get exponential, we know it is getting exponential as of now, looking at its enhanced transmissibility, we will see severe cases. And I'm certain about it that the coming weeks will be a story that we're going to talk about.
Dr. Swain, also, we can't really be sure that this is only the Omicron variant that is going through the population. The other variants still do exist, isn't it, like Delta?
Yes. So,
well, actually, what I think is that I think right now it is pretty clear that the new surge is because of Omicron, because although we've only done a limited number of genomic sequencing, wherever cohorts of people have had genomic tests, 70 to 80% of them have turned out Omicron positive in the last 3 or 4 days. So in fact, I think we are reaching a point where we will no longer need to do genomic testing. We should just assume it is Omicron. So you're right that when it was in the period of switch, let's say 2 weeks ago, there was a mixture of Delta and Omicron, but now I suspect it's going to be all Omicron, and we should assume it's all Omicron.
Okay. Dr. Sibal, many countries have reported more children falling ill. Why is that so? And are we prepared to handle that situation?
Well, I think we need to realize that kids have never been immune from COVID. If you look back at the second peak that we had, and if you look back at data from the start of the pandemic, about 11% of those inflicted with COVID-19 were less than 19. So it's not that kids were immune, and if kids haven't been vaccinated, they remain vulnerable because, all experts have been saying this, that everybody needs vaccination. It's a question of prioritization, and you have to be very logical in your approach and risk stratify, which is the right approach that India has followed. But if we will have children who are not vaccinated, and I'm glad that vaccination for the teens has started, they do remain susceptible to getting this infection. The good news, of course, is that the infection, even with the Delta variant in them, was very mild, and they did not really require hospitalization in any significant numbers, and that MISC, which a lot has been said about it, was 1%. So it's not that the kids have been away from COVID, or that in the coming days, 2 weeks, 2 months, they will not get infected. The key here is that they have a milder course, and with Omicron anyway, at least in early days that we've seen, is milder. That is also the case for children. So in terms of need for hospitalization for children, I think that will remain sort of minimal, which again is something very positive.
Yes, hopefully that everybody hopes that is how it should remain. But the evidence from other countries, at least as of now, Dr. Sibal, hasn't been very encouraging. We've seen record number of hospitalization of children in America, as well as even in South Africa. A lot of children have been impacted. But
that's because of absolute numbers. Please look at the percentage. The percentage still remains the same.
All right.
It's the absolute numbers. If the absolute numbers skyrocket, then even if the percentage is the same, the numbers will increase.
Dr. Parker, under such circumstances, should India have opened up vaccinations for children earlier as well? After all, by November, we knew that we'd have surplus vaccines in December. So why couldn't have vaccinations opened up for more people, even though there wasn't, great coverage even of single dose across the country? But since many of the vaccines were just lying and many of them may have expired because of that, should we have opened up this vaccination earlier for children?
Well, I really can't ascertain whether it should have been opened earlier, but I do understand that the vaccination for the children, which has been initiated in the other countries, I think we should have taken a hint from that and maybe we should have started it much earlier, because every time what we are doing is we are following the Western world, because they are 6 months ahead of us. So we should have made our preparations, and I think we should have started earlier. And I think the pediatricians would agree to that, of what I'm saying.
Dr. Sanjeet, would you say that that would have been the right approach?
Well, I think
Again,
so, because the
it's a very
surge
tough
is so
question.
huge that, then we run helter-skelter and we don't come to know, and then we take decisions which might not be that appealing, because it is creating a lot of anxiety amongst the parents and amongst the children also. For 2 years, children are at home.
Yes.
So you can imagine what
Yes.
the impact it has on their mental status, and even on the parents. So I think, rather than creating a atmosphere of anxiety, which is very much prevalent and which is causing psychological effects on the children as well as on the parents, we should have been much more crystal clear, so that, everybody would have been at peace, and I think the process would have taken very smoothly.
Sorry, Dr. Sanjeet, go ahead. You were saying something.
Yeah, so I always believe that the school should have been the first to open and the last to close, and vaccines would have been the right time, because of the fact that they can be administered as quickly as possible to schools. I mean, to vaccinate a large population, it's a common pool of individuals that can be vaccinated together at a certain school. So obviously the take up would have been much better, and we would have been much more confident of opening and keeping our schools open. Now, as Dr. Jalil also said, the same thing. The social, emotionally, all the IQ, everything is getting impacted of these little ones, and the vaccination would have definitely prevented all these problems that we are looking into, especially because we know from the earlier wave what happened and what happens in other countries. We know that, and that's probably the reason that we should have opened the vaccination for children much more earlier, I feel.
Also, Dr. Soen, I want to come back to you, because there's a tweet by the lead epidemiologist of World Health Organization, and what she really is saying is that the fact that Omicron may have milder symptoms doesn't mean that it is not resulting in fatalities. So what data do we have on that count as of now?
Well, we don't have any fatality data in India so far. Luckily, we haven't. I think we've had 1 or 2 deaths so far from Omicron. Even in South Africa, the number of fatalities have been less, and the people who have died among the Omicron patients in South Africa have been largely unvaccinated, and or people with comorbidity. Having said that, the same point I would like to reiterate, that even if the percentages of people having severe disease or dying are going to be low, and we certainly hope, and there is evidence that they are, even then, if the sheer numbers go up 3, 4, 5 times compared to our second wave, which it appears likely, because that's what's happened in the US, that's what's happened in South Africa and UK, then we are still going to have a lot of deaths, and we must gear up for managing patients with severe disease. Having said that, so far, I mean, at Medanta, we have just 18 admissions, and none of them are in ICU, but this is early days. We don't know what's going to happen in the next 2 or 3 weeks. So we have to be very careful and be on a vigil in case things turn nasty.
Dr. Sibal, final question to you. It is being said about the Omicron variant that it is, unlike Delta, not impacting the lungs directly. How much of it is true, and what does it mean?
I think we need to wait and see how this pans out. We need to learn a little bit more about this virus. Let's not ignore the fact that this variant is just about, less than 2 months old. And while we want all the answers, I think we will get the answers in time, and I don't think we can fast track that. But I think what each one of us is trying to say here and trying to reach out to everyone who's watching is that please be on guard. COVID avoidance behavior is here for you to stay. This is something that each one of us needs to embrace. In terms of healthcare facilities, I think the preparations are on a higher level than they ever were, and all the equipment, whether it's in terms of oxygen and so on and so forth, everyone's better prepared. We also have better tools in terms of management. And I think because of the greater degree of experience, knowledge, expertise, sharing of knowledge, I think we are better prepared. And it's better to be prepared and then not have to use those facilities. And I think that's what we are hoping and praying for.
Yes,
And
absolutely.
hopefully, if we continue to vaccinate and if people are sensible, we should not get ourselves into a situation like we did
In the second wave.
during the
Yes,
second wave.
Yes. Many thanks to
Can
all.
I get a quick word in?
All right, Dr. Swain, I have 30 seconds. Go ahead.
No, I just wanted to make a point about guidelines about isolation and quarantine of healthcare workers who test positive. I think we need to have these guidelines revisited, because if a lot of us test positive, then healthcare services are going to suffer, and that's going to be a problem.
All right.
So asymptomatic and mild cases perhaps just need isolation or quarantine just for maybe 5 or 7 days, and not the original 10 to 14 days.
That's what the CDC in the US, in fact, had said because of the number of cases that were being thrown up there in America. Many thanks to all four of you for joining us, allaying fears there of the people and also cautioning them at the same time. We're getting updates of the COVID numbers from Maharashtra. Let's quickly give you the details with regards to Mumbai, which is reporting 10,860 fresh cases of COVID today and 2 deaths as well. Mihir is joining us with more details. Mihir, that's again a huge spike that Mumbai is seeing, isn't it?
Absolutely, and it's recurring on a daily basis. One can say that because it was very soon that Mumbai reached from 200, 300 to 3,000, then 8,000. It's been on the 8,000 mark since last 2 days, and now suddenly a spike of 2,000 more cases. Today in the morning, when the mayor took a press conference, she said that everybody needs to put their guards up right now. There is no need to panic because the health infrastructure is in place and they are in a position to manage the numbers if they are coming. But what we are seeing at this point is there is a significant constant burden on the health facility as well. The occupancy rate in hospitals is constantly rising. In fact, that has to jump up from 12% to 15% now. The worry is if this numbers continue, then Mumbai could very soon touch the 20,000 mark, and that's when there will be some stricter curves because that situation needs to be arrested. However, measures are being taken to arrest the virus.
Okay. Mihir, many thanks for joining us with all those details. With that, we're closing the show. Thanks for watching. Bye-bye.